Hey everybody, so as you know, we're going to be all about priming the body to heal. What does that even mean? So it's a continuation from last week, and our blog is going to kind of align with everything that we're doing here in yoga as well as the blog. So if you want to kind of go in that journey, go refer back to last week's content on my website, alkalinewellness.com, under blogs, as well as you can find this on our YouTube channel, Dr. Connie Jian. I wanted to create content that will kind of catapult you into thinking a little bit more in alignment with healing. So for that, today is all about learning how to move our individual joints. What happens is I see so many patients in my physical therapy clinic because of inflammation and calcification that occurs in their respective joints. And some patients end up getting total replacement surgeries and arthroscopies and what have you. We just ended our yoga teacher training program, and one of the students on that program, we talked about how all of a sudden she just her meniscus on the left side just broke loose, and then she needed, as she was preparing for the hip surgery. So I was explaining how everything that happens in our body is due to repetitive stress and injury, and that's exactly what I want to talk to you about as a way to prevent that from happening, okay? So it's all about mastering your body, being tuned into your body, and knowing how your joints move to decrease the inflammation in the joints, because if there's inflammation in any of our joints, calcification occurs. When your bones calcify near or around the joints, it can start to have or irritate the receptors around the joints, where we have abundant amounts of pain receptors around our joints, as well as it starts to fray and impinge on the tendons as well as ligaments that cross that joint. It's not a good thing to have. So starting with our wrists, our shoulders, we've got the elbows, we've got the knees, hips, and of course our spine, as well as our ankles. I just want us to kind of focus on how to move them. So let's start with our upper body today. Our neck bends forward and it bends backward. Learning to know how much movement you have in that plane of motion is important for you to start moving your body more mindfully. So we're going to learn how our bodies are designed to move. Do that a few times, because what you're going to notice is you never take the time to flex your neck all the way down to its maximum bend, and you never really take the time to extend the neck to its maximum extension. But if we don't move, we lose the mobility, we lose the strength, and that's not a good thing. So bring your neck back to center, and then let's rotate our neck all the way to the right. And you might feel like crack and pops in your joints from lack of movement, and all the way this way. And go down and to the right, and go down and to the left. Leave your shoulders out of it, meaning you don't want to strain them up toward the ears. See if you can relax them as best as you can. All the way up and all the way to the left. And when you move this way, you're going to see that it's very therapeutic. So now I want you to bring your right ear to the right shoulder, stretching this side, and you feel a nice stretch this way and back up. Then to the left, and feel this right side, the opposite side, stretch and back. And one more time, and back and forth. Good job. Wrists. I want you to clockwise rotate your wrists 2 more times, and then the other time 5, 4, 3, 2, and 1. Your hands. Flex them, make a fist, and then extend them all the way. Flex and extend, make a fist, and extend. 3, 2, and 1. And then there's your wrists. Bend them all the way down and straighten them all the way. Do you have full range of motion, right? And see what muscles you can feel when you do that. So you learn, oh, it's my biceps that flexes, and it's my triceps that extends my elbow, right? These are things that you should know. This is your body part. The thing is, what we find so fascinating is that we don't come with manuals. And you entrust people like me, who's in physical therapy or orthopedic surgeons, to know what's best for your body, fix you. But really, how we move is an internal thing, right? So learning to move your body and learning how to use your body is key. And these are like very basic things that nobody teaches us. So it goes flexes and extends, but we also pronate and we supinate, right? Palms down, palm side up. And see if you can do that and see what happens in your shoulders. Are your muscles doing that? And see how, like, at will, you're able to move those muscles. Let's talk about the shoulders. It flexes all the way up. How much motion do you have? And when you do flex them all the way up, do you tend to hyperextend your back? And feel the spine when it does that, right? Go all the way up. What's happening in your spine? What's happening in your core, right? And down. This is flexion, and a lot of us have frozen shoulders. I don't know how many of you have that, but I certainly treat that a lot in my clinic. You guys end up in my yoga classes to create more mobility. We need mobility, but we need also strength. We also need stability, right? To be able to move at our maximum capacity. And the whole end goal is to be able to enhance movement, move efficiently, improve metabolism, and improve elimination to detoxify efficiently, right? Move all the way up and down. What muscles are doing that? Are you feeling the pops in your shoulders? Can you really generate energy coming from your muscles to volitionally, or, to make this a voluntary control? Like you're making this happen, right? Place your hands on your shoulders, and then you're going to move your elbows, circle them back, forward and back too, and what's happening with your core, right? So it's not just your elbows and the shoulders that are moving, it's attached to the core. What's happening to your neck when you do that? So understanding these isolated movements, and oftentimes we find ourselves like coupled movements. It becomes a compensatory mechanism, the way we move our bodies, creating a lot more degeneration faster than we'd like it to happen. So being mindful of that is all about that yoga practice, right? So that's all of it in the upper extremity. I'm going to come onto my hands and knees and move my spine now. I'm on my hands and knees. I'm going to sink my belly all the way down and lift my tailbone straight up. And I'm going to exhale, tuck my tailbone down and under. And I feel a lot of soreness back here, but I'm pulling the navel in. I don't have anything pooching out to kind of modulate this effect. And I'm doing it with full control, all the way up. And exhale all the way down. Inhale up. And exhale. And up. And exhale. And that's our spine, right? All the way up and back. Let's stay in a neutral spine. Move your hips to the right and move your hips to the left. That's the lateral flexion, right? Side to side, side to side. And then we're going to move into our hips using our arms. We're going to sink back into what's called a child's pose. That's a lot of deep flexion in our knees, deep flexion in our hips. And then come all the way up and learn to extend your hips, right? And then bend back. And that's our flexion. And then extension of the knee, extension of our hips, and extension of our spine. Flexion of our spine, flexion at the hips and the knees. And back. All the way forward and back. All the way forward, using your muscles. See if you can really use your biceps, use your hips, use your quads, use your glutes, and see if you can tune into your body. And back. All right. And then from there, we're just going to sit on our bum and then bring your knees together and flop open. In and out. In and out. And how much motion do you have there, right? And then let's extend your legs. Toes out, toes in. Toes out, toes in. That's the rotation at our hips, right? See if you can have your hands on your hips and feel those muscles working. And then place your hands next to your glutes and bend your right knee and straighten. Bend your right knee and straighten. And see if you can see your quads contract. Toes up. And left side. Bend and extend. Bend and extend. And then from there, lift the right leg, circumduct, right ankle, 5 times. 2 and 1. Go counterclockwise, 2, 3, 4, and 5. And set it down, same thing. Counterclockwise or clockwise, 2, 3, 4, and 5. Counterclockwise, 5, 4, 3, 2, and 1, and set it down. And that's how we learn to move. And I'm not sure, as we practice whatever we practice, it can be circuit training. Some of you guys walk, some of you guys bike, some of you guys practice yoga, some of you maybe Pilates. But are you tuning in to your body to command control over that? That's what we aim to do with our alkaline method yoga, and that's what I promote at our practice, Alkaline Wellness. And you can keep following these series and learn to move your body, because moving your body is an elemental key to enhancing your body's ability to heal by enhancing the ability for dynamic movement, facilitating and promoting strength, stability, and flexibility. All of these things are absolutely needed for longevity and health, as well as to enhance our metabolic engine, which ultimately can help us to decrease inflammation and improve efficiency, metabolism, elimination, ultimately the whole detoxification. So I hope you enjoyed this section today, or a sequence, and then next week I'll be back with more. See you guys.